With most of us, brushing the teeth has become an accepted and integrated part of our daily living. Kathy, like millions of other normal, healthy persons, enjoys good oral health. She brushes her teeth regularly. Kathy has maintained an excellent set of bright, shining teeth, pink, glistening gums, and an attractive smile. For her, toothbrushing is a simple and rewarding task. But for many persons, the brushing of the teeth is a laborious effort, and often impossible with conventional toothbrushing methods. With the handicapped, the aged, and the chronically ill, oral hygiene is often one of the most neglected aspects of cleanliness and health. Perfect oral hygiene is seldom the possession of any individual. Yet, a degree of oral cleanliness and tissue stimulation can be maintained by all, even in the presence of incapabilities and handicaps. The care and maintenance of the oral cavity is unfortunately a function so often misunderstood by many people. Kathy has had the good fortune to acquire proper brushing habits at an early age. She uses a firm, straight-handled brush with medium stiff bristles set in tufts, equal in length and spaced well apart. She learned the rolling stroke method of toothbrushing. Pressing the bristles against the upper gums with sufficient force to momentarily blanch the tissues, the brush is swept downward. Each quadrant of the upper teeth is brushed separately, with each area overlapping the one previously cleaned. The lower teeth are swept with an upward motion. The chewing surfaces are cleaned by working the brush tips into the pits and fissures to remove debris. The entire brushing routine is repeated 6 times. Kathy brushes immediately after each meal and, if possible, after eating any other time. This is easy for Kathy. She's a normal, healthy person in full possession of all her faculties. A sense of touch is nearly all the blind have to guide them to oral hygiene. The blind person can readily perceive a new experience if told about it in detail. Instruction is clearly and concisely given. Teaching aids are most helpful if oriented to touch. Usually, the blind person will have intensified sensory responses and learns quickly. For the mentally retarded, a special program of group instruction has been found most useful. Institutionalized mentally retarded patients receive instruction from one of the people who cares for them. Particular effort is taken to make the experience as pleasant and comfortable as possible. A happy association will motivate the children to practice and eventually adopt habits of oral care. Using a model of the teeth, directions are slowly given and reinforced by demonstrations in simple steps. Coordination is often a problem, and some children do better if the brush has a curved handle. The brush handle is easily bent to fit the desired shape after a little heating. A toothpaste dispenser has magical qualities, and it avoids the problems encountered by handling tubes that squeeze so easily. The children have the opportunity to do for themselves. Constant daily repetition of brushing training is part of the regular schedule of activities. The response is gratifying. Patients with physical handicaps of the upper extremities are carefully evaluated as to the extent of their disability and the remaining strength and mobility. From this appraisal, an adaptation of the most effective tool and method for toothbrushing is suited to the particular patient. There is no rule or system. A brush adaptation that will be ideal for one patient may be useless for another with a similar handicap. Oral hygiene aids are those best designed for the removal of debris and simplicity of use. Rather than being taught a brushing technique, the patient learns the simplest, most effective method in keeping with his individual capabilities. Close supervision while training is essential, as are periodic checks to assure that the most effective cleaning possible is achieved. For this patient with polio residuals, a plastic pocket with a Velcro closure is fitted over the hand to hold the brush. Patients with limited grasp or the inability to close their hand are often helped with a simple adaptation of the brush handle. The crippling results of arthritis may be compensated by the attachment of adhesive-backed foam rubber sheeting, cut to shape and rolled over the toothbrush handle. Due to the wealth of new materials readily available, great versatility in adaptive devices is easily accomplished. A bicycle handlebar grip may be used to facilitate grasping. A foam plastic hair curler slips easily over the handle. The bristles are removed from a fingernail brush, and with the aid of epoxy, the handles are cemented together. A rubber ball and an orange juice can are utilized to fabricate a very wide handle. This patient with muscular dystrophy is unable to lift her hand to the area of her mouth. A long handle was affixed to an ordinary toothbrush, thus permitting the patient to clean all of her own teeth. Quadriplegics with complete flaccid paralysis of the hands or arms are often able to perform most of the activities of daily living with the aid of an externally powered, patient-controlled orthotic system. The system is powered by compressed carbon dioxide, stored in a small tank under the lap board. When the patient activates a switch, a minute amount of gas inflates and shortens the artificial muscle, thus restoring movement by means of hand or arm splints. With the use of this system, much of the function of the upper extremities is restored, and therefore the patient may attend to his own oral hygiene. Automatic toothbrushes, now commercially available everywhere, have been a boon to many persons with limited function. The mechanical action of the automatic brush relieves the patient of motion that may be extremely tedious or even impossible. Often, a simple adaptation of the toothbrush to facilitate grasping is made. As with the manual brush, adaptations are made to suit the particular patient's needs. A ring attached with a rubber band is often all that is necessary to stabilize the instrument in the patient's hand. Extensions, as seen with the manual brushes, are also utilized with automatic brushes. This extension is made by cutting the handle apart in the middle and cementing a strip of plastic to the cut ends. A swivel brush head, allowing much greater maneuverability, may be attached to the automatic brush mechanism by means of a simple adaptation. This patient, suffering from myositis ossificans, a chronic progressive muscle calcification, has extremely limited function. With the aid of a homemade extension to the handle of her automatic toothbrush, she is able to competently attend to her own oral hygiene. Many patients with cerebral palsy and other forms of spastic paralysis do not have sufficient motor coordination or control to permit the use of any kind of toothbrush. Their rigidity and spasticity is often intensified by their efforts to cooperate. An efficient mechanical cleaning device, now commercially available through regular dental supply outlets, consists of a slotted sponge body with a flexible rubber handle. It requires no dexterity except the ability of the patient to chew after the device is inserted in the mouth. Toothpaste, plus a few drops of glycerol peroxide, is placed in the slots of the sponge. This implement conforms, in general, to half the human arch. The appliance is inserted into the mouth, and the patient chews in a normal manner. The handle, used only to insert and remove the appliance, is shaped to be controlled effectively by any two fingers the patient is able to use. This patient, with a little practice, will be able to manipulate the chewing device by herself. A dense oxygenated foam is released. This acts as an effective lavage, hydraulically cleansing the teeth of debris and stimulating gum tissue. The appliance is removed after a few minutes of chewing, cleaned and prepared for use on the opposite side of the mouth. The flushing action of the chewing device is effective and comfortable in cleaning the gingival mucosa and crevices. The device is then flushed clean and reinserted for 1 or 2 chews on each side. The entire unit may be sterilized and the sponge rubber section is replaceable. Bedridden patients who are unable to care for themselves present a situation that requires another person to attend to their oral care. Oral hygiene for the institutionalized patient is the functional responsibility of the professional staff. This responsibility, however, may be performed by properly taught aides, attendants, or family members. Effort is made to assure that proper oral habits are carried out in a home environment. Oral hygiene for the comatose hospitalized patient is primarily a nursing problem and is accomplished by a member of the institution's staff. A degree of skill is required to perform a routine of toothbrushing. To clean the mouth, to prevent debris from being inhaled in clogging air passages, to minimize the possibility of oral infection, and to provide comfort for the patient, are all necessary factors to accomplish this procedure. A towel is placed under the patient's chin and over the bedding. Accumulated debris is wiped from inside the cheeks and lips. It is desirable that the routine is performed at least twice daily, and more often when indicated. A toothbrush with attached suction provides an efficient and safe method for patient care. A commercially available brush has small holes drilled between the bristles in the middle of the brush head. Tubing is connected by an adapter to an aspirator or suction outlet. Mouthwash is used as a germicidal vehicle. The lip is gently retracted, and the rolling stroke method is utilized. Frequent rinsing of the brush and tubing by dipping the brush in clear water is advisable to flush the tubing and to prevent clogging. The care and maintenance of the oral cavity is an essential aspect of the general health of the unconscious patient. Many old people have a great feeling of insecurity. They may have a general disregard for their own appearance. Often, with the aged, encouragement is as necessary as instruction. The establishment of a sense of rapport between the patient and the therapist is always essential if progress is to be made. The aged seldom require a specialized approach to dental hygiene unless they are physically handicapped. But usually, patience is necessary on the part of the attendant to have the elderly realize the importance of oral hygiene. With faulty memories, they tend to forget and must be reminded repeatedly. Since senility is accompanied by difficulty with adjustment and perception, slow, gentle, cheerful instruction adapted to the patient's personality and limitations is necessary to achieve results and reestablish an aura of well-being with a healthy oral cavity. The majority of the aged, however, are denture wearers. Many believe that the necessity for careful hygienic measures has been removed with the natural teeth. Deposits and stains accumulate on the surfaces of the dental plates, and if the accretions are not promptly removed, they will irritate the soft tissues and may well be a handicap to the social acceptance of the individual due to bad breath. To prevent the accumulation of adherent masses on dental plates which cause irritation and often halitosis, a regimen of cleaning the dentures must be followed. Rinsing with a satisfactory mouthwash should be a part of the regular cleaning procedure, whether this is performed in an institution with assistance or by the edentulous person at home. A commercially available, inexpensive automatic denture cleaning unit is extensively used in nursing homes and similar institutions. The dentures are placed in the bowl with detergent compound and warm water. Agitation and aeration swirl the cleaning solution mixed with air bubbles into the crevices, contours, and anatomical characteristics of the dentures. After approximately 2 minutes, the dentures are removed and brushed thoroughly. The bowl is thoroughly cleaned after each use. It is desirable to have an individual unit for each edentulous patient. The loss of an arm or hand poses a difficulty to the denture wearer in respect to cleaning. Inexpensive, simple fabrication is again effectively utilized. Suction cups are attached to a fingernail brush, allowing the patient to attend to his own needs. The chewing device may be also used for the edentulous to clean and stimulate the gums. Optimum oral health is an important contributing factor in maintaining or restoring the patient's physical, emotional, vocational, economic, and social usefulness to the extent of his capabilities. Each handicapped individual presents a special, distinct problem which must be considered according to his fundamental needs. With skillful, imaginative application of basic dental hygiene knowledge, all persons, regardless of their handicap or environment, may achieve and maintain a reasonable measure of sound oral health.